Good day, dear friends. With you, Natalia, on the channel Doctor Online, on which I share personal experience and answer your questions. Today, we will talk with you about a very important indicator of a general blood test, erythrocyte sedimentation rate. It used to be called erythrocyte sedimentation reaction. It is from this indicator, in fact, that the diagnostic search for various diseases occurring in our body begins. Many of us believe that an increase in erythrocyte sedimentation rate can only be associated with the presence of some serious illness, but this is not entirely the case. For example, an increase in the erythrocyte sedimentation rate is quite often observed during pregnancy. In this case, this indicator can, on average, increase up to 25 millimeters per hour. Such figures are explained by the fact that anemia is quite common in pregnant women, with the blood being diluted. The reasons for the increased sedimentation rate of erythrocytes can be heavy food intake directly before the analysis, strict diet or fasting, various types of allergic reactions. Elevated erythrocyte sedimentation rate indicators are also noted during anti-allergy therapy. In some cases, an accelerated sedimentation process of erythrocytes is an individual characteristic and does not relate to deviations from the norm. Many of you are interested in the question, what diseases can an increased erythrocyte sedimentation rate indicate? The first and most common cause are various kinds of inflammatory processes. The second place is occupied by benign and malignant tumors. Third place is taken by intoxications and diseases of the rheumatological profile. Among infectious diseases, the most frequent cause of accelerated erythrocyte sedimentation rate syndrome are pneumonia, viral hepatitis, acute respiratory infections, acute respiratory diseases, bronchitis, cystitis, pyelonephritis, and others. In the presence of various diseases of the rheumatological profile, such as systemic lupus erythematosus, rheumatoid arthritis, systemic scleroderma, rheumatic polymyalgia, an increase in the sedimentation rate of erythrocytes is also observed. This indicator increases with disturbances in metabolic processes and also in the presence of pathology of the endocrine system, hypothyroidism, thyrotoxicosis, and diabetes. An increased erythrocyte sedimentation rate can be noted in various diseases for which the disruption of tissue is characteristic, such as oncological processes, strokes, and infarctions, as well as infectious diseases. Despite the fact that the erythrocyte sedimentation rate is a non-specific indicator, its diagnostic value is enormous. So, we gave blood, and we turn our attention to such an important indicator as the erythrocyte sedimentation rate. The norm for women for this indicator is within the range of 3 to 15 millimeters per hour, for men from 1 to 10 mm per hour. Why do representatives of the strong sex have a larger size of sedimentation compared to men? This is explained by the lower density of erythrocytes per milliliter of blood, which allows them to settle faster. The change in this indicator is noted at the early stages of the development of a pathological process, when other analyses are still not informative and remain within normal limits. The detection of a raised erythrocyte sedimentation rate is a guide to action for further comprehensive examination and clarification of the situation in each specific case. Were you with Dr. Savkina? Subscribe to my channel so you don't miss out on many new interesting and useful videos. And stay healthy!